remarks. And if there are questions that are similar to ones asked earlier, I'll probably skip those over, but in general, we're going to try to cover everybody's comments and questions. So please feel free, that's what this forum is all about. So let me just turn it over now to Dr. Peter Beilenson, who is going to make some introductory remarks. Right now, you're still muted, Dr. Beilenson.
Thanks, Steve, and thanks, Olivia, for being here as well. I'm going to start off by giving our, our number of cases and positivity as I do each time. We're at 24,102 cases now, which was 42 in the past day, which puts us in the orange level, as I'll talk about in a minute, for at least the last day. We have a 2.2% test positivity rate. That means of the people that have been tested for the virus, 2.2% are positive, which is down significantly from where it was about a month or two ago, and is in the almost yellow range. We have 75 people hospitalized, 15 of whom are in the ICU, which is down at least 75% since late July or early August. So our public health division has been doing a phenomenal job. We have 464 deaths. It's a 1.5 to 2% case fatality rate. In other words, 1.5 to 2% of people who get the virus die of it. 85% of those who die of the virus or viral-related cases are 50 and older. But I'm going to let Olivia talk a bit about the death rate. But what I want to talk about briefly today were what are called the long haulers. And some of you may have read about this, but there are a good 10% and possibly a lot larger percentage of those if they were in the hospital, but 10% of those who have gotten COVID, which amounts to 800,000 Americans who have, is the 10% of the 8 million that have gotten COVID. 10% have long consequences of chronic sequelae, chronic conditions, cardiac, respiratory, musculoskeletal, and especially neurological, with things like brain fog and extreme fatigue that last for months, if not years. And so I think it's important to point out when we talk about coronavirus that although it is very serious and there are a lot of deaths, there are a huge number of people who have long-term consequences, and that should be discussed as well. The tier system, for those of you who don't know how the tier system is set up, the governor has set up a system of guidance of multicolored tiers, purple being the most restricted when you have the most widespread infection rates, then red, orange, and yellow. We are in red right now. We are red for cases per 100,000 and orange for our percent positivity of tests. So we come out red, although we are hopefully heading towards orange on both of those metrics, which is what the tiers are judged from. And so to that end, we have a campaign going on right now to turn Sacramento County orange by Halloween, which is a cutesy little topic. But anyway, the idea is to have everybody do one of three things. Always indoors, except in your house, wear a mask. Second, always be socially distanced, 6 feet or more from someone inside or outside. And third, no gatherings inside your house outside of the members of your immediate family. And we think that if you do that, we'll be able to move Sacramento to orange. And just by looking at our statistics, we've had a dramatic drop in the last few weeks. Again, thanks to our public health staff. So that's where we are with the current set of data and where we are with the chronic cases and our campaign for turning Sacramento County orange by Halloween. And Olivia, if you open up your mic, you can go ahead and talk about deaths and Halloween. Not in that order necessarily, but Dia de la Muerte.
Okay, yeah, I wanted to clear up one question that's come up to us about the deaths, because there was a report that the Centers for Disease Control put out where they mentioned that 6% of the deaths are in people who have no other underlying conditions. Unfortunately, that has been misconstrued to mean that only 6% of the people die of COVID. And just wanted to explain that, and this is true also for what we're seeing here in Sacramento, is that most of the people who get severe disease and most of those that die also are people that have underlying conditions such as hypertension, diabetes, kidney disease, lung disease, heart disease. And so when we get the death report, and just to let you know the process we go through, if a person dies in the hospital, the report, we get not only the death certificate, but we also get the hospital medical records, and we go through them to find out what has happened through the course of this person's last days. And so we're able to figure out what the complications were. And the doctor also puts on the death certificate whether it was related to COVID or not. So it's not just a simple process. There are several people who review those reports, and after we review it, actually goes to the state and is reviewed again to make sure that everyone is in agreement that this case should be counted. So most of them, you'll find that they did have underlying conditions, but there are a few, as Dr. Beilenson pointed out, over 75% of the cases are in people over the age of 60. But what has happened over time is, as we get younger and younger people getting COVID-19, some of them do get severe disease. And so that's where the 6% comes in, because if you have someone who's maybe in their 20s, 30s, or 40s, does not have any known underlying conditions and ends up dying, then on the death certificate, it will say complications due to COVID, but nothing else. So just wanted to make sure that everyone's aware that when we are determining the cause of death, we go through a process, we look at the records, we have to have agreement with what the doctor puts down, and that is also reviewed at the state level as well. Switching gears to Halloween, our request this year is that you try to have it in your home. So change things around a little bit, and maybe be able to have a virtual party with your friends, or be able to do things around the home with your children. If you do choose to go out, we have put together some guidelines for how to do that safely, in terms of making sure that you avoid gatherings or crowds, that you try to have a touch-free delivery of the goods, in terms of finding innovative ways of being able to provide the candy to the children, that candy that's prepackaged, or having it out at the table so that they don't need to come and ring the doorbell. And of course, the important things that Dr. Beilenson has pointed out again, have a face covering, hand sanitizing, 6 feet of separation. All of those are really important, because we want to make sure that, yes, it's okay to have fun, but we don't want to end up with a spike in our cases as a result of the activities during Halloween.
And I think I should stress that the typical Star Wars mask is not an N95 mask. So when you see those kids come to the door and your temptation is to go and see them and get close to them, you probably should back off a little bit, because you're not truly protected as you might think you are, just because their face is covered. So why don't we go ahead and move on to some questions. Thank you everyone for sending them in, and we'll try to get to everyone, though we may run out of time at the end. The first comes from Junior Goris, who wonders about the testing available. Says, does the county have a good supply of rapid COVID-19 tests, and are the tests reliable?
So I could take that one. We do have community sites that provide a PCR test, which is the gold standard, and that those tests, after they get the swab, and then it's sent off to the lab and tested. And we've had a very good turnaround time. I believe the folks have been getting results within 24 to 48 hours. So that is our recommendation for you to use. There are some tests called rapid antigen tests or point of care tests that are used in certain settings. They're most ideally used in situations where someone is exhibiting symptoms and you want to get a quick answer to make decisions. So for example, in the urgent care, emergency room, maybe a long-term care facility or a school. If you are using them for surveillance in people who are not exhibiting symptoms, there's a certain percentage of false positives. So you have to be really careful about that. And so our recommendation is for most people, they should be using the PCR testing, which is available. I don't think that anyone is having too much of a hard time being able to get access to that testing right now.
There are some questions about contact tracing. First, perhaps, Dr. Kasirye, you can just quickly describe how contact tracing is done. And then the question to ask has to do with where cases are coming from in California. There has been some talk about contact tracing here, pointing to family gatherings, churches, and bars. That's back east. But the question is, what about here in California? What have we discovered from the contact tracing that's been done?
So I'll talk about the first part if Dr. Beilenson would like to take the second. So as far as what contact tracing is when we get a report of a positive, we call the person because when the lab gets the results, they also send us the contact information. So we call up the person and interview them to find out where they have been, who they have been around, and then try to get information, contact information for the people that they have been around because those people have been exposed. And then we will call those individuals whom we call contacts and let them know that they have been exposed and then provide them with information about quarantine and testing as well.
And the second part of that question is about what has been discovered here regarding from contact tracing. For example, there is a question relating to the malls. They've been closed for a long time. Is there evidence that there are cases attributable to people just passing in the hallways in the large shopping malls?
There does not, I'll take this and then Olivia can chime in. There does not appear to be a problem with the malls in the past. In fact, they're allowed in at 25% now of capacity. And it's partly because they have a huge, they have huge entryways and high ceilings, and it's almost like being outdoors. What we saw originally, and when we were getting hit pretty heavily a couple months ago, 3 months ago, was a lot of the cases were coming from gatherings, family and extended family and friends, and potentially from bars. They've kind of now morphed into second and third generation cases where people who got infected came to like a local business and showed up there. But again, the public health division has done a phenomenal job at working these cases, and we're now down to a level where we actually can do contact tracing for everybody, for all of the cases. Whereas before, when we were getting 250 to 300 cases a day, it was impossible. So we're now able to get to a manageable situation for our public health staff.
Very good. There's a question about the term that you used, positivity rate. And the question really is the positivity rate up because we're doing fewer tests right now? Well, you can answer that one first.
Well, actually, we've been getting substantially better. Again, the percent positivity is the percent of people who take the test who test positive. That has gone down from 8 point something to 2.2%, which is way below what the goal is of 5% nationally. And we're hopefully going to continue to drop that. And we're actually testing more and more people now many more than we used to.
And Sarah is asking, despite the decrease in our positivity rate, can we also anticipate a similar surge as the rest of the country is experiencing?
It's totally a educated guess. If you look at like the Spanish flu back in the early 1900s, they did have a second and even a third phase, and there was a thought that there was thoughts that that would occur here if for no other reason than many more people, particularly on the northern hemisphere or the northern side of the hemisphere, going indoors as it gets colder, and people much more likely to spread the disease when it's indoors. However, it's interesting. We're already halfway through October, and we're continuing to go down. That's not to say that this won't happen a second phase, but I think if we remain very, very vigilant, as we've been for the last 2 or 3 weeks, 2 months or so, it's conceivable that we, at least in Sacramento, where we have pretty good weather, it may not get a second phase. But that's just an educated guess.
Right, and of course, the testing and the contact tracing are part of that vigilance.
Absolutely.
So there's a question from an anonymous attendee. He's wondering about the recommendations now for gathering indoors. The recommendation was that we not gather indoors with people not from our families. And if that's the case, how is it then that we can send kids to school to gather in their pods at school?
Olivia.
So there are a couple of things about that. And in public health, oftentimes we do have to weigh different actions depending on what we need to do at that time. So we've always had a goal of being able to have children back in school because we know that in-person learning is the best for the children. But we wanted to do that by getting the level of cases in the community low enough so that it's safe to have the children in school, because otherwise, if you have a high number of cases, you'd end up having to reclose again because you have a lot of people coming up positive within the school. But if it is low, and if you are putting measures in place to safeguard against infections and transmission, then you can have a situation where it's safe enough to actually have the children in school. So we went through a very extensive list of things that the schools had to do, even for those that actually went through the waiver process. They had different criteria that they had to meet in terms of 6 feet of separation, in terms of having stable cohorts, in terms of making sure that there's symptom checks before children get to school. Of course, we can't completely eliminate every risk, but our goal was to make it safe enough so that we could have children back in school. And that was the reason for doing it.
And regarding the children in schools, there's some question about the use of masks. One of our attendees is asking, or mentions that the second grade child is encouraged, is there at school, but is not required to wear a mask. Yet the CDC says that children 2 and older should be wearing masks. What is the current status in California or in this county?
The reason that the state put that recommendation, put it that way in the guidance, is that especially if children are going to be in school for the whole day, the thought was that it might be more of a challenge to ensure that the younger children, less in first and second grade, are able to comply for the entire day with the face masks. And so that was the consideration for that, but definitely making sure that you have the other measures in place as well. The 6 feet of separation, hand sanitizing in cohorts, and so on. But actually what I am hearing from a lot of the other counties that already have schools open is that there's very good compliance with face coverings by the children, even better than it is for adults. So it is encouraged, but definitely I think it is possible for the children to be able to do it. So
very good. There was one question that I missed earlier from Martin, and he wants to know, have there been cases attributed to casinos? I know we have none in our county, but some of our
Oh
residents.
no. No. We have a lot of card rooms.
Oh, we have card rooms.
Yes, and we've with hundreds of places. They've done a really good job. Olivia, correct me if I'm wrong. I don't think we have had any at these
No.
card rooms. There are hundreds and hundreds of
That's
people.
our knowledge.
They've been very good about coming up with guidance, and a lot of them are working out of their parking lot and having them go from cars, and doing good hand washing, etc. So I think it's actually been a good result.
So we're allowed to play bingo in the age of COVID?
Yes.
Very good.
Smaller capacity, but yes.
Paula Kuhlman is asking, are most deaths happening in the hospital? And her second question was, how effective are telehealth appointments in really assessing a COVID patient?
So yes, most of the deaths that we get are actually people who have had severe disease, have ended up in the hospital, stayed there for several weeks, and then unfortunately end up dying. But of course, as I mentioned, it's because oftentimes these are people who have chronic diseases that put them at an increased risk for severe disease. Also the elderly, especially those over the age of 65 are at increased risk. And then what was the second question?
About telehealth appointments.
The reports that I'm getting about telehealth in general is that it has been very helpful and successful. I think it really depends on what assessment is being done. I think in terms of being able to talk to the patient, ask about symptoms, and also observe how they look and how they're talking. But in terms of getting vital signs and oxygen saturation, that does need to be done in person. So there are some things that are easier to do by telehealth. But I think one thing that telehealth can tell you is if you're looking at somebody and they are obviously having difficulty in breathing, then you'll say, look, you need to check into a hospital right now.
I guess it would be safe to say that it's hard to generalize about that. Can you share with us the zip codes or neighborhoods that have higher cases of COVID at this point in the county?
Yeah, they've actually rotated amongst themselves for the last several months, but right now 9583438 in North Natomas and towards North Highlands are high. Oak Park is high, and Elk Grove and Galt are high. If I'm not mistaken, those are the ones that are the most affected. But almost every zip code has been affected now.
And we do have an updated map on our dashboard that shows you which zip codes have the highest cases.
George Meyer is asking, what is the false negative rate with the PCR test?
It's low, right? It's not like 5%.
Yeah. It's lower than that.
Maybe less.
Mm-hmm.
All right. And Michelle Gore is asking, what retesting protocols are used for patients who test positive on an initial test, but currently show no signs of symptoms? I realize some types of tests may show false positives. So let's just say somebody tests positive with a rapid test, but they're asymptomatic. What would you recommend that they do for follow-up?
So if it also depends on the circumstances. If somebody is getting a rapid test, which is the antigen test, and they don't have symptoms, they're not part of an outbreak investigation, they're just doing this either for surveillance or just because, that needs to be followed up with a PCR test. But if it is part of an outbreak, then the assumption is that that test is positive and we need to treat it as such. Also, of course, if the person has symptoms, then the antigen test is taken as positive. I think the question was also asking about repeat testing. If a person has tested positive, then they have to go through the 10 days of isolation. We do not recommend having to do a repeat test to find out if they're negative before they can leave isolation.
And sticking with testing for a short time, there's one type of testing that is for antibodies that we haven't discussed in a while. Why don't you just tell us what the role of that testing would be and whether the antibody tests are accurate at this stage?
They have not been particularly accurate from what I've seen. The antibody tests obviously are, they see if you've been infected with this virus, with the antigen, you develop generally immunity with most viruses, and they come in the form of antibodies, which last for a certain period of time. It's different for every virus. The idea was that with people who had made the antibodies, that they could potentially have a plasma, which is the serum from the blood, with the antibodies, and give it to someone else who has the virus to help them get cured from it. But from what I've gathered, and Olivia, correct me if I'm wrong, there's not been a huge push towards that, because instead they're actually working on monoclonal antibodies, which are produced in the lab, and they're monoclonal, so they're against one type of virus, in this case the coronavirus, and they are given to you, and this is what was given to Trump and Walter Reed. They give it to you to help fight off the disease. And that has very few side effects, and it's been used with Ebola and other types of viruses as well. So I think that's what they tend to be using now.
What about convalescent plasma?
Convalescent plasma, they're not so much. It was a big discussion about 3 months ago, and it has really not gone anywhere particularly that I know of. I'm sure it's available some places though.
Mm-hmm.
So Christy London is asking, is the county, what happened to that? Oh, is the county working on plans to continue community testing if the funding for that testing is not extended past December?
That's the board decision.
Yeah, but I'm sure we are, with Olivia's strong help, we will be pushing to continue the testing. It's absolutely crucial. I think another one of the questions is, how long is this going to go on, the virus, before there's a vaccine or before there's herd immunity or whatever? And I think it's clear that it's going to be probably July. We will get a vaccine before then, but in terms of widespread use of the immunization and more people getting the virus, it'll be at least July. So we're going to need a good 6 months of testing, probably a year's worth of testing. But we will certainly get it.
So we have a tennis player in our midst, and George Meyer's asking, if an indoor tennis facility has 2 buildings with 4 courts in each building, what can they do to meet our county's guidelines? So we're talking about indoor sports with limited numbers of people, and I think we should also add pickleball to that.
So that's non-contact sports. We have asked for the state to clarify where that falls, because before the tier system was set up, we had permitted it. But then, of course, when we shut down again, all that went away. And then when the state introduced the tier system, they did also introduce guidance for conditioning, but did not include the other non-contact sports. So there's been a lot of questions that have come up asking about that. We are still waiting for clarification. I think they have a long process for being able to approve the guidance that comes out. So as soon as they do, we will let you know.
Right, and of course, some of that will depend upon ventilation in the buildings, which is hard to know. All right, so Christy London is also asking, Sacramento County is recommending COVID testing for students and school staff. What are the plans for doing this testing? Will the county be supporting schools to offer testing at the school, or do the districts need to develop their own testing programs, especially if the community testing ends in December?
So we've been working very closely with the school superintendents on this, and we actually have a system set up, and Dr. Beilenson was key in this, and Liz Gomez as well. We can't see her, but she's in the background, in getting a contract in place for us to be able to offer testing free of charge. And this is surveillance testing for school staff. As far as students, right now there is no guidance or recommendation to do surveillance testing, which is like ongoing serial testing for students. I think some schools are thinking of maybe doing that using some of the rapid tests, but in general, the students will only be tested if they are exhibiting symptoms or if they are part of an investigation, contact investigation outbreak. And for that, we will be using our public health lab so that we can get results rapidly.
So now there's a question on vaccines. And Helene Houston wants to know, it's now said, I think this was Dr. Fauci, that the vaccine won't be plentiful until next April. Earlier, we were talking about January of 2021, and they're curious what your opinion is about that.
Yeah, so I'll take a stab at that first. I think it's quite likely that in January or February, we will have a vaccine available that will work fairly well against the virus, potentially more than one vaccine coming from more than one company. The question is, how quickly do we get the vaccine into the people, if you will? And there's two parts to that. Number one is just the practicality of getting 200 million doses into people in America and 4 billion around the world. And the second is how likely are people to get immunized? So right now, the polls that I've seen have showed that about 60% or 65% of people are willing to get immunized, at least right now. And so that leaves a good third or more of people not getting immunized. But if we get 65% or so immunized, along with the 10 or 11% of our population, which has already been affected by the virus, we would probably hit 70% for herd immunity that's needed, where you have enough people that are immune to the virus that actually the spread of the virus starts going down. But again, I don't think we're going to get widespread application of immunizations until June or July. I just don't see it now. In April, as Dr. Fauci was saying, there will probably be people among them, the elderly, the underlying conditions and healthcare workers, those most at risk, who will probably get immunized by March or April or May. But I don't think we'll have widespread immunization available until the summer. Just my guess.
I think we should add, though, that your 65% figure, if we're successful with good public health campaigns, we might be able to get larger numbers of people, educate them,
yes,
to understand the need for the vaccine and how it will help them. So
yes.
Let's hope for that. Just a detail, Chris Spiegel is wondering about the detail of contact tracing and about length of exposure. When doing contact tracing and wondering whether you've been exposed, what kinds of questions or what is the time frame that we're usually talking about for exposure?
When the definition of exposure is a minimum of 15 minutes and being within 6 feet of somebody. But usually when we're doing the interview, the person will ask questions about the room, how many people are in the room, how much commingling there was, and so that kind of helps.
And mask.
And mask, yes.
Well, here's a question. It's a good one about businesses reopening, and it's a special case. Shelley Peters is asking, so what is the capacity for businesses to have patrons? We are a meeting Hall and need to get back to business. How can we do that?
So, well, go ahead, Olivia.
Yeah, right now, actually, our advice is that as much as possible, your meetings should continue to be virtual. So the only people who are regularly going to offices are people who, you know, work in businesses that they cannot do remotely. But otherwise, for the most part, the meetings and should be virtual, as well as you know, minimize the number of people that have to be in the office as well.
So one of our attendees is asking about the correlation between higher infection rates, as you mentioned, for certain zip codes, and the fact that schools reopened in some of those areas a few weeks ago. Is there a correlation between the schools opening and the higher infectivity rates, say in Elk Grove or other places?
No, certainly not to date, because the schools have just opened about 2 days ago in terms of Sacramento County. And so we've not seen that an increase or a decrease or a stabilization from the schools. They just opened on Tuesday.
It is different when you're looking at colleges, though, because from the experience we've heard from other counties, there have been some outbreaks in colleges, but for the grade schools, there has not been any correlation. And even when you look at the guidance from the World Health Organization, the advice is that if you have a positivity rate below 5, then it is deemed safe enough to be able to consider opening schools.
And we're at 2.2%.
Good, thank you. So here's a question from Linda Cortez. And the question really has to do with the process of putting out the vaccines. Are you comfortable that all of the pre-testing has been done appropriately on the vaccines that are coming out this year?
So I always get in trouble when I toss in some politics into this every time at the end of of our presentation. So I'll try to keep that out. Right now, as long as the FDA insists on making sure that the vaccine is being produced appropriately, and that people who have adverse consequences are at least pulled out of the vaccine trial, or the vaccine is pulled out of the vaccine trial until they have adjudicated that, I think it makes sense that the vaccine will be appropriate. And the longer we go after the election with the vaccine coming out, I think the more safe it'll be.
All right. Here's a question from an anonymous attendee. Given there are over 5,000 people living unhoused in Sacramento County every night, what resources are the county providing to protect them from COVID? Where can they go to find masks, sanitation supplies, and/or safe shelter that adheres to CDC guidelines?
Oh, very good question. We've had a massive effort in terms of both in terms of those who were in congregate settings that are homeless, that are classified as homeless, that have underlying health conditions, are of a certain age. They've been put up in motel rooms for months now, and I think we're 1,000 at any given time. We're in the hotel rooms. They're now about 600 or so. Then in addition, for those who live in the encampments, there is CDC guidance, which Olivia has put out, that we use for the encampments to keep them from being shredded or moved to a large extent, because a lot of healthcare is brought to them there, and then there's water and food and other things that are brought to them where they are. So we don't want the encampments moved terribly much. In terms of what's available for them out on the encampments, there are porta potties. We have 50 of them, large ones. Hand washing stations, food, water, and a few other things. But we've been making every effort to serve the homeless folks, and we have, I think, less than 120. Is that right, Olivia? 110 or so cases in the homeless population overall, which is pretty remarkable considering how large it is.
Very good. Are there plans being made for mass vaccination events?
Yes, we
Yes.
two things. One is flu shot, which we shouldn't forget. There are 17 sites that the county is running, and potentially one large one. All the pharmacies, CVS, Walgreens, the hospital systems, they all have flu shots. It's very important to get a flu shot. As we talked about, I think last time, in the southern hemisphere where it's been flu season, in Australia and South in Africa, et cetera, they've had a much smaller flu outbreak than normal. Because people are doing the appropriate things like mask wearing and distancing that work against the flu as well as against the COVID. In terms of preparing for the COVID vaccinations, I know that there's been a lot of work from the California Department of Public Health to get that ready, and maybe Olivia, you could toss in something.
Yes, we are working on plans. Part of that will depend on what type of vaccine is made available and how much. So we have several contingency plans for how to deal with it in terms of prioritizing where we will have the clinics and who we would start with.
So here's a practical question. With flu season coming, how will we know if it's the flu or COVID?
You can test for flu and COVID. There's actually a twin test and there are separate tests. But the most useful thing is to get a flu vaccine. And even if it doesn't prevent a case of the flu, in most cases, it at least makes the flu less severe. And the whole reason to worry about the flu is during this season is not so much whether it's flu or COVID, but to keep as many people out of the hospital and the ICUs as possible, so that if there is a second surge with COVID, we're able to treat those cases.
So regarding just practical matters, if someone has had their flu shot and sometime in November they develop a cough and a low-grade fever and scratchy nose and eyes, achy muscles, should they wait? Should they contact their doctors right away? What would you recommend?
Olivia?
Usually we do recommend that they at least check in with their doctor, especially if it's an individual with underlying health conditions. We don't want you to wait. If the symptoms are mild, it might be okay to wait and see what's going on. But I think there are several factors to look at: the age, someone having other chronic conditions, and also, of course, this year we do have COVID as well. So I think we will see more people at least checking in with their healthcare provider when they exhibiting these kinds of symptoms, just to be sure. You can still go in and get a COVID test, at least make sure that it's not COVID.
Here's a question that deals something with privacy. As an employer in Sacramento, will public health contact us if one of our employees becomes infected, perhaps if they do not report it to us first? Is this part of contact tracing?
Yes, it is. And it's an important part of contact tracing. So that's why it's important that people give us all of the information so that we are able to make the appropriate connections. I also want to point out that although in general we tell people that if they are diagnosed with COVID-19, that they should go in isolation, but it's a little different for people who work in what is deemed critical infrastructure or essential services, where in some situations, if a person has a positive test but has no symptoms, they can still work if they work in one of these businesses. So another reason why it's important for people to provide us with that appropriate information so that we can follow up.
And what if it's a strange situation where the contact tracer speaks with somebody who is positive and they say, don't tell my employer, I don't want him to know?
Those are things that our contact tracers are actually trained to deal with in terms of explaining the reason why it's important for us to provide that information. because we also have to check the workplace and make a determination as to whether there were any exposures, and that can be done confidentially without revealing the name of the person, but at least we do need to make that contact. So those are the conversations that the contact tracers have.
So Sarah's writing in wondering, is there any information on how long vaccine immunity will last? Would this also be like the annual flu shots that we get?
Yeah, we really don't know. There's been a lot of studies, a lot of things have come out on the virus, and we'll certainly know more in the next several months. It certainly seems to have it last at least 3 or 4 or 5 weeks, months, sorry. And then the T cells, a specific type of immune cell, probably retains the ability to go back and fight the virus for a longer period of time, but we really don't know yet exactly. And we're only 10 months in, 9 months into the outbreak, so I don't think we really know yet.
And I think the other thing to mention is that not all the vaccines are the same. They have
Correct.
different kinds of platforms, and the long-term benefits are still under evaluation.
Right.
Karen writes in wondering, what would make a primary school close with regards to COVID?
Once a school has opened, if they do have cases, they are required to report those cases to public health. And we will make a determination on whether, hopefully in most situations, we'd only need to have maybe the cohort go into quarantine. But if you're having cases in different classrooms or multiple cases in one classroom, and it seems to be spreading and doesn't seem like it's well controlled, there might be situations where you might make a decision to shut down the school for at least maybe 14 days and give time to make sure that you stop the spread. So many of those decisions are made between the school officials and public health.
And regarding schools, if we go back to purple tier, there's a lot of community transmission. Will the schools need to go back to distance learning?
If the school has opened, they will continue to be able to have in-person learning unless they have cases within that school that then warrant the closure.
So one of our anonymous attendees is asking if you're willing to say, if available, are any of you comfortable getting the vaccine before 2022?
Yes.
Sure. If I get the information that it has gone through the appropriate process, yes, I would be comfortable doing it, and probably folks in public health will be among those that will be considered to get the vaccine first, because we will be the ones giving it out to everybody else. So.
And I should say that the recent news about some of the pharmaceutical companies having to halt their trials because of problems that have popped up means that this really is being treated in a standard fashion. There is due vigilance at this point, and I think that should be reassuring. At least it is for me.
That's the important thing, yes.
Here's a question from Beatrice. If someone is having mild symptoms of an illness, what should be the first step for a concerned person? Check with their medical professional, go to a community testing site for COVID-19 test? What would you have them do first?
A lot of factors. It again depends on several things. If a person does have comorbidities, I think it's very important that sooner rather than later that they do check with their medical provider. But for a young person who is just exhibiting maybe the sniffles or extreme fatigue, I think it's okay in those situations to just go to a community site and get a test.
And Dr. Kasirye, maybe you can remind people, are multiple sites open? How long is the wait? And how much does it cost to have a test done?
The community sites, we have 11 sites that are available. One is Cal Expo, the drive-through. The other 10 are within the community. And if you go to our website, I think Liz can provide that link in the chat, in the Q&A, where those sites are. You do have to register. There is also an opportunity to register on site, but we do have availability for slots for testing. So I think that if anybody wants to get the test, they can get it.
And it's free.
And it's free, yes.
And everyone should look at the chat to find a link regarding testing. It's readily available. All right. So I think one of the important things for us now to quickly consider is, how do we prevent Sacramento County from experiencing the same sorts of things that are happening in the mountain states and other parts of the country where the disease seems to be running rampant? What are the optimal things we can be doing at this point to help us prevent that as a county?
Well, the first thing is masks. I mean, it's clearer and clearer as we get further and further into this outbreak that wearing masks are extremely important, much more important than, for example, washing your hands from touching something. It's useful to use hand sanitizer. I'm not saying it's not, but the way this disease is spread is face-to-face, without masks, within 6 feet. I mean, that's the way that you really get this. So the fact that Californians wear masks more often than some other states where they're not mandated probably is helpful. In addition, I would say
Gatherings.
the work of the public health staff has been tremendous, and that they're doing the outbreak control that is allowing us to keep things under control. Again, as I said, the fact that we're now down to a manageable number of cases per day means it's not only that we can open up more of our economy in a piecemeal fashion, but also we can manage the cases of COVID with our contact tracers. And that's absolutely crucial to be able to keep the disease down. So we can, if a fire breaks out somewhere, they can snuff it out before a conflagration occurs.
And avoiding gatherings, because that's what got us in trouble in the first place. And I always remind people that you can skip one birthday because we want you to be around for next year's birthday as well.
Right.
We've had stories of people who've gone ahead and there's one gentleman who wanted to celebrate Mother's Day and took his mother, didn't realize that he was actually passing on COVID-19 to his mother. And unfortunately, the mother ended up passing away. So those are things that we really want to avoid. I know that sometimes there have been questions about churches, and just want to say this is not an effort at all on our part to stop people from being able to worship. I think the fact that we are in this year where we can do things like Zoom or go online, YouTube, and still be able to worship with our church families, I think we need to take advantage of that and just make sure that we avoid unnecessary risk.
Yeah, and that is especially holds true for this holiday season. It's a very unfortunate part of COVID, obviously, that we don't want people to have massive Thanksgiving dinners or Christmas dinners or whatever. But really, I think, in all honesty, it'll only be for this year. That by next year at this time, we should be in a much different situation. And as Olivia was saying, much better to be around for 14 or 50 more Thanksgivings than one.
Very good. There is another question about the availability of testing in primary care settings. Can the providers, are there tests available in many doctors' offices?
Yes, many of them are able to do the testing in their offices. I think the best is for you to call and ahead of time and make sure that they have the test available. But many of them, the urgent cares, the community clinics do have the test available.
I have to say from personal experience, I sent an email to my Kaiser physician, asked for the test, and it was arranged the next day. There are a couple of big testing centers in Sacramento on Howe Avenue, also in Roseville, with multiple sites for testing. So at least in that system, it is definitely available. I would recommend that you call your doctor's office and find out. Here's a good question. Speaking of complying with mask requirements, I've noticed a number of police officers in Sacramento who are not wearing masks when interacting with the public, most notably Sacramento sheriffs and California Highway Patrol. Who holds law enforcement personnel accountable as far as these COVID guidelines? How do we report noncompliance?
So you can report noncompliance to 311, and I encourage you to do so. We've been working with the sheriff's department, particularly in the jail, and they're now much better about wearing their masks. But it certainly is important, and it's important for modeling the behavior for everybody in the community. So again, by calling 311, that gets reported to a variety of entities, including myself.
As a follow-up to the employer question asked earlier, if we know of an employee who is positive, do we have to report it to public health?
So what we have, the guidance that we had put out before, actually, definitely if you get 3 or more within a period of 2 weeks, we definitely want to hear about that. But right now, since the number of cases we're getting is reasonable, that we're able to get to each and every one of them, yes, we do encourage that you contact public health and let them know if you have a case.
Dr. Kasirye, we heard something about the homeless population. Do we have a handle on the undocumented population in Sacramento County? How has that group fared with COVID-19?
So it's a bit difficult to get the exact numbers because all the services we provide, we do not ask about the status, visa status, because we don't want people to feel like that's information that could hurt them. So, and the data that we have, that we collect, that information is not readily available. But one good thing is that we do have contracts with community-based agencies that provide services to the undocumented. And so they're able to do outreach to them and provide them with the testing, provide them with services. For example, if they do have to go in isolation or quarantine, make sure that they have food, that they have somewhere where they can isolate.
And there is an anonymous attendee who wants to go back to the schools question. If we go back up to purple tier, and there seems to be widespread disease, maybe you can explain why the schools would remain open in that setting. You can go back to that question. What's the
Sure.
thinking behind it?
Part of the thinking about that is that we all know that a lot of planning goes into being able to actually open a school. And so trying to minimize the disruption to the schools was the state did make that decision that if a county did regress, that that would not be an automatic closure of the schools, but it does depend on the circumstances. Say, for example, if the school is impacted, of course, then in those situations we will close the school. But the decision was mainly in consideration of trying to minimize disruption.
Very good. Regarding hotspots that we've spoken about in the past, What about the nursing homes, the situation there, the aggregate care facilities?
The nursing homes have had a massive amount of testing done, and whereas they were by far the largest number of cases, including deaths, I think there was over 60% of the deaths were actually nursing home. It's now down to 40%. And there's many, many fewer places now that have people testing positive. Just as an anecdote, my mom is at an assisted living place in Arden Arcade, and they had 50 people, who tested positive there out of 84, 85 people. And it's now down to 0 staff and 0 patients. So it's actually manageable. And there, because we've done so much testing, there's much less around. That's not to say that there's no problem. There is, and obviously if an elderly person from a nursing home gets sick from the COVID, it's much, much more serious than a 30-year-old, but it's better than it was.
And I understand that visitation policies have changed somewhat.
Yes, they have.
So it's a time for vigilance for sure.
Yeah.
Well, it's hard to believe, but we are actually at the end of our questions, and we've spent a solid hour talking about this. It's right. And I must say, this has been a wonderful session. I'd like to thank both of you for coming and spending time. I know how busy you are during the day with these topics, but the public likes to hear what's going on, and I think this is a great opportunity for them to learn and learn more about this disease problem. So I guess we will end our evening, and thanks again to all who have come, and I'll say good night.
Good night.